Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele presenting Health Equity Teachers Module, Navigating Limited Health Literacy. In the previous presentation, we spoke about health literacy, what it is, and the implications it has on an individual's health care and health. The objective of this presentation is to take it a step further so that by the end of the module, learners will be able to discuss strategies that healthcare providers can implement on the interpersonal and systemic levels to address limited health literacy and reduce its negative health consequences, as well as learners will be able to review components of a patient's care plan, including nutrition and medications with a patient using universal health literacy precautions. So to begin with, we're going to go through many different strategies that we can implement as providers to navigate and care for patients regardless of their health literacy limitations. But the overall goals that I want you to take away from this presentation are these: that, as always, we want to provide patient-centered care that is built on shared decision-making, and this should happen regardless of the patient's limited or non-limited health literacy skills. So that should always be the standard of care. And we can do this by using language, both written and verbal, that is of 5th to 6th grade level, and that matches a patient's language. This may sound like a low grade level, but studies have shown that it is the 5th or 6th grade level that is the safety net that most patients can understand. We can also use communication aids. This means videos, photos, diagrams to promote understanding for those that may not have the best written and verbal communication. And we can also ensure, we also want to ensure that patients understand the information, medication regimens, and treatment plans that we are using and that we are deciding to implement with the patient. And we can do this through methods like brown bag medication reviews, the teach back method, the show back method, and many more. And lastly, the last goal, overall goal for navigating limited health literacy is encouraging the patient to participate and ask questions. By empowering the patient to get involved in their healthcare, we are increasing their literacy, increasing their shared decision-making, and truly making the care patient-centered, which is the overall goal for us providers. Now, we talk a lot about screenings when it comes to a lot of different social determinants of health and patient limitations. And there are screening tools that exist for health literacy. There's a rapid estimate of adult literacy, test of functional health literacy, newest vital sign, something as simple as asking the patient, how confident are you in filling out medical forms? But these screenings are not supported by evidence in that say that health literacy screenings improve health outcomes or enhance patient-provider relationships. So I didn't want to focus on screening methods here. They're used a lot for studies and measurements of patient skills when it comes to research. However, in the clinical practice, providers should implement universal health literacy precautions. What this means is that with all patients, providers should apply the same skills, care, and methods for communication that will enable any patient, regardless of their health literacy skills, to take part in their healthcare, understand their healthcare, and make decisions for their health. Now let's get into the strategies for promoting health literacy. The first I'd like to discuss are things that you can do to improve verbal communication. So this is all about your conversations with the patient. First, you want to be welcoming. Listen carefully. A lot of times us providers tend to talk a lot and talk at the patient without actually listening to the patient, their concerns and needs. As I said, we want to use the 5th to 6th grade language level or lower. And with that language, you want to use plain, non-medical language. Don't use medical jargon. Use words that the patient can understand. You can speak at a clear, moderate pace and be specific and concrete with the words that you're saying. If you're being general and hard to follow, patients are going to get even more confused, even if you are still using language at a simple level. So keep it concise, specific, concrete, and prioritize the content of your conversation. It's very overwhelming for patients to verbally hear all this knowledge that's being spit out at them. So limit it to 3 to 5 key points that you want those patients to understand, and repeat those key points so that patients really take them away. And you can confirm that they're understanding these key points by using the teach back method, the show me method, and continue using these methods throughout the visit. So the teach back method is when you give the patient information, whether it's you're telling them that you're going to prescribe them a medication. The teach back method would then be, all right, so it'd be saying, all right, I just gave you a lot of information, I prescribed you a new medication. Can you tell me back or repeat back to me what I just told you and what you understand from what I told you? Then the patient would then, in their own words, tell you what they took away, and from what they told you, you can address errors in that communication pathway, or be confident that they have it all correct and they're good to go. The show me method is similar. It's more so the demonstrations. So then if part of the treatment plan is an action, like teaching a kid how to use an inhaler for asthma, and after you instruct them on how to use the inhaler, you then have them show you how they use it. So then they would demonstrate in front of you, and you can let them know whether they're using it correctly or if corrections need to be made. Likewise, demonstrate how to do things. Don't just verbally blast them with instructions. Medications, exercises, lead them through and demonstrate how to actually do it so that when they go home, they're not just trying to remember what you said, but they have a visual as well. And lastly, with verbal communications, language barriers are always problematic when it comes to health literacy. How can someone be expected to understand health and navigate the United States healthcare system if it isn't appropriate for their language? So you should be using trained interpreters or qualified bilingual staff members to address language barriers within your office. Patients should not be given unqualified staff members who may be a little bit conversational language but aren't fluent, because it can really, even though they're there and they're convenient, they're not trained to do that, they're not qualified, and it can really limit the patient's care even if that staff member is trying their best. So again, use qualified and appropriate interpreters and staff members for language barriers. Now with written communication, a lot of times something that can be used to improve health literacy is to supplement all these verbal instructions we're giving patients with written handouts, like instructions that the provider gives and writes out themselves, or pamphlets that have already been created by other organizations or the office. But you can use easy to read materials that again are at that 5th to 6th grade reading level or lower. The written material should be short, simple sentences using bullet points when possible. The information should be chunked into clearly marked sections so that the patient can follow where the written text is going. Again, limiting medical jargon and defining terms when necessary. So sometimes in written language and you're trying to describe a condition to a patient or treatment, jargon's inevitable, like a drug name or a disease name. We have to kind of use that to introduce it. So define these terms very clearly, have it in writing so the patients can learn and refer back to these definitions. But again, try to use less medical jargon when possible. Lastly, when you are giving these written communications out to patients, you don't want to just hand them a bunch of resources and say, here, read these. You want to go through and read through and review the materials with the patient, making sure that they understand what you're giving them, and underlining and circling key points that you really want them to take away so that they understand that what their care should be. As well as we can use something that you can use at a systemic office-wide or hospital-wide Protocol is using checkboxes instead of asking patients to write answers, as that may be easier for patient literacy skills. We can use visual aids. So just how written handouts can supplement verbal instructions, visual aids can supplement both verbal instructions as well as written instructions. Sometimes patients simply have difficulty reading sophisticated documents. So pictures are also always good to clarify what is meant. So you can use simple pictures to avoid including unnecessary written details. You can use diagram and models to show relationships between things. Something that's new is photonovellas, which is kind of a twist on telenovelas, which is a soap opera kind of story, but using photos. So comic-like sequence of photographs describing a condition, describing a treatment, action, or plan. You can also use videos. There's so many videos out there for different conditions, drugs, treatments, recommendations that are at various different levels, even videos for kids that you can show your patients. And I think a great example of using visual aids is that pharmacy line, CVS Pharmacy, has now on their prescription bottles, instead of writing in the morning, in the evening, in the midday of when to take these medications, they have pictorial representations. So they have the sun rising, the sun in the middle of the day, the sun setting, darker colors, and then bedtime with the moon. So these are times in which they could take medications, and then they'll label the number of pills that they'll take at each time of the day based on these visual suns and moons. Again, trying to make these medication instructions more understandable for our patients. Now, in addition to just straightforward communication that we think of, another thing you can do to truly increase someone's health literacy or meet someone where they're at with their health literacy is empowering patients to self-manage, because in the end, patients have to take care of themselves. We give them the means to do it. They have to be the ones to do it themselves, though, when it comes to eating better, taking medications on time, following exercise and treatment regimens. It's all on them. So you want to empower them to do that and self-manage. The first thing you can do when it comes to empowering your patients is asking them, what should I know about you? Whether it's part of your culture, your beliefs, religious practices that can alter your care and help me take better care of you. Encourage patient participation. So ask patients, what do you think this is? Has this happened before? Ask them what their opinions are on their health to encourage them to participate in that shared decision making that we strive for. Questions are huge. We want patients to feel comfortable to ask questions, because that's how a lot of times they have questions and they're ashamed to ask them because they don't want to show that they don't understand something. So instead of asking, do you have any questions? Ask, what questions do you have? Because that makes it clear that we expect them to have questions and that it's okay to have questions. And additionally, you can ask patients to come prepared with 2 to 3 questions for the appointment. This can be ahead of time. You could have a sign in the waiting room to say, all right, write down 2 or 3 questions you have for your provider today. For self-management, medication is a huge part of self-management. So you want to write precise instructions for medications, offer different methods for medication organizations, like pill boxes, so that patients truly know how to take their medications and are organized enough to take their medications so that they can by themselves. You can create an action plan for your patients, creating step-by-step instructions that patients can take to attain larger goals. Ask for patient feedback. Asking them for feedback makes them feel included. It truly incorporates them into their care and empowers them to really be a stakeholder in their health. Making follow-up appointments with patients, whether it's in-person appointments, phone calls to monitor their health, confirm that they're doing the appropriate treatment regimens, or to schedule new appointments, is so important to create consistent, continuous care and ensure that their care is being managed continuously. Lastly, you can train patients how to use your practice's patient portal and the internet so that they have these resources, whether it's the ones that you give them, that your practice provides, or that are just out there on the internet at their fingertips. Now, a huge part of health literacy is medications. Medications are only as good as the patients are able to use them. So even if we prescribe patient medications, they're not going to do anything unless patients are taking them correctly. They can even be harmful if they're not taking them correctly. So you want to demystify medications with your patients. And one way to do that is something called a brown bag medication review. So ask your patients to bring their medications to their appointments so that you can go through them together. Bring them in a bag all together. And this is so important because it can help you determine what medicines the patients are taking, how they are taking them, and it can help identify errors and misunderstandings that would otherwise go unnoticed and could harm the patient. So once the patient has brought in their medications, you want to ask them one by one with each medicine bottle, what do you take this medicine for? This will help you understand whether or not the patient knows what the medication is for and why they're taking it. Ask them when they take it to make sure that they're taking it correctly. And then can you show me how much you take each time? Again, confirming that they're taking the appropriate dosage. Doing something like this, taking a couple minutes with each appointment to do this, will help ensure that the patients are self-managing correctly and that they are understanding the instructions that you are giving them. This concludes our module on navigating limited health literacy with your patients. I hope that you've taken away some of these strategies that you can do just one-on-one with your patients at the level of your healthcare practice or hospital, and that you can understand that doing these or applying these strategies to every single patient you see can truly empower patients and allow you to provide patient-centered care with shared decision-making. Thank you.